You know, we encounter microplastics everywhere in the environment, our food, and our own bodies. Scientists are still looking into exactly how microplastics affect men and women, but experts are now calling for action after plastic additives have been linked to male infertility. Dr. Parviz Kavoussi, reproductive urologist at St. David's Austin Medical Center, joins us now to discuss this. Welcome, Dr. Kavoussi. We appreciate your time again. So last year, scientists discovered that microplastics exposure affects sperm count. And earlier this month, experts are calling for action. Tell us why this is so alarming.
Yeah, so what we're actually seeing is a significant decrease in fertility in men over decades, over about the last 50 years. So from 1970s until 2000, we see a steady average drop of sperm counts by about 1% a year. And then more alarming, from 2000 to now, we're seeing greater than a 2% drop a year in sperm counts. So as a population, men are getting less fertile. So we're all trying to do work to figure out why that's happening. And obviously there are some other contributing factors: sedentary lifestyles, obesity, waiting longer. But this is really investigating the effect of some external factors in these plastics. And so we see that there are two major additives that are added to plastics that are having a really adverse effect on male fertility. One is the phthalates and the other is bisphenols. So phthalates are what are added to plastics to make them soft and pliable and flexible. And then bisphenols, like BPA that most people have heard of, makes plastics hard. So whenever you're dealing with those plastics, you kind of have an idea of which is in which depending on the consistency. What we've learned is that phthalates actually decrease testosterone production, and bisphenols in men actually increases estrogen production. And so this alteration of our hormonal axis is bad for sperm, and we see sperm counts drop with this. Microplastics are also being found. These are degraded microproducts from plastic products, and they're actually showing to actually damage the DNA of sperm as well. A process called sperm DNA fragmentation, where if we see too much of that, that not only can decrease pregnancy rates, but it can actually increase miscarriage rates as well.
All this leads to a fertility crisis, right? We discussed a few months ago about how childbirth rates are down, and now this. So what action can be taken? What should men do besides stop using plastics?
Yeah, well, I think the number one thing is, in the here and now, is trying to minimize exposure. So use glassware, use other type of products rather than plastics. Don't warm up food in plastics.
Especially the black containers.
Absolutely. So you're getting extravasation of these additives into the food, and we're consuming them. They're found in all sorts of fluids and cells in the body. But ultimately, there needs to be really guideline changes, and actually nationally and international changes on plastic production for this overproduction of plastics. I mean, you walk down the grocery aisle, everything is in a plastic container.
Yeah.
So it's a real big problem that we need to look at. Now, other options in the here and now are at least to look for products that say they're phthalate-free, BPA-free, so at least we know those additives aren't in those products and going to be as harmful for fertility.
Have you seen this in your patients?
Well, it's really hard to isolate out because there's so much plastics around us, and it's really hard to tell a guy to live in a bubble for 3 months at a time, which is how long it would take to have that effect gone. So do I think it's contributing to what we're seeing over time? Absolutely. It's one of the contributing factors. Very hard to isolate it actually in an individual patient.
All right, Dr. Kavoussi, thank you so much for your time and your knowledge, of course.